Hello, my name is Evie and today I will be discussing my understanding of pregnancy and health. We will be talking about gestational diabetes, preeclampsia and the dangers of substance misuse while pregnant. Gestational diabetes is a condition when women get high blood sugar during pregnancy, and this usually goes back to normal after the baby is born. This happens when your body is unable to produce enough insulin as you have extra needs in pregnancy. While any woman can get this, there are several risk factors that can increase the likelihood of high blood pressure. Women who are at the age of 25 to 30 are at higher risk, and the risk increases even more after the age of 35. And this is because insulin naturally declines with age. Being overweight or obese is one of the highest risk factors, as the body struggles to regulate glucose levels. Family history of type 2 diabetes increases this as well, especially if this is a close relative like a parent or sibling, or personal history of polycystic ovary syndrome also raises the risk. Carrying multiple pregnancies like twins can increase the risk, and women who come from certain ethnic groups like South Asian, Black and Middle Eastern have a higher rate of developing gestational diabetes. Gestational diabetes can be diagnosed through a screening test during the second trimester. If you are known to be at higher risk of developing gestational diabetes, then you may have the screening test earlier. The screening test usually happens between 24 and 28 weeks of pregnancy, as this is when hormonal changes are at their highest and insulin resistance becomes more apparent. The most common test to diagnose gestational diabetes is the initial glucose challenge test. This is when a mother drinks a syrupy glucose solution, and then an hour later the mother will have a blood test to measure the blood sugar level. If the result comes back as the blood sugar is higher than expected, then the mother will need another glucose tolerance test. The follow-up test is similar to the first test, however the drink has even more sugar in, and the mother's blood sugar is then checked every hour for 3 hours. If 2 out of 3 readings are higher than expected, this means the mother has gestational diabetes. Diagnosis is mainly based on this screening test. However, mothers can experience symptoms such as increased thirst, urinating more often, fatigue and blurred vision. Some women may even experience recurrent infections like urinary tract infections and thrush. A care plan for mothers with gestational diabetes focuses on keeping the mother's blood glucose levels within a healthy range to reduce complications for both the mother and the baby. The mother will be given a testing kit that can be used to check their blood sugar levels. This is a finger pricking device which allows a drop of blood to be put onto a testing strip. The mother will be taught how to do this correctly, told how often and when the blood needs testing, and this is usually before breakfast and 1 hour after every meal. They will also be taught what level they should be aiming for and how to share these results with their care team. If the mother already has problems with low blood sugar, then they may be advised to use a continuous glucose monitor. This is a small device that the mother would wear on her skin, and this sends information to a receiver or even a mobile phone so the blood sugar levels can be checked at any time. A healthy diet can control your blood sugar levels. Healthcare professionals may advise the mother to eat regularly and not skip meals. Eating foods which release sugar slowly can improve this, and eating plenty of fruit and vegetables and avoiding sugary food and drinks. Exercise may be recommended as physical activity lowers blood glucose levels, so exercising regularly can be an effective way to manage gestational diabetes. If blood sugar levels cannot be controlled and exercise and changing diet has not helped, then you may be offered medicine. This can be form of tablets called metformin or insulin injections. Extra monitoring of the baby is usually recommended, as gestational diabetes can increase the risk of the baby having developmental problems like growing bigger than usual. This monitoring can include ultrasound scans to check growth and the amniotic fluid levels. When a mother has gestational diabetes, the prime time to give birth is around 38 to 40 weeks. If the blood sugar levels are normal and there are no concerns about the baby, then the mother can wait for labour to begin naturally. However, if the mother has not given birth by 40 weeks and 6 days, they will be offered a cesarean section or induction of labour. If there are any signs of concern for the baby or the mother, then the health professionals may recommend an early delivery. During labour and delivery, the mother's blood sugar levels will be monitored closely, Healthcare professionals will be there to decide if the mother needs to have insulin through a drip to help control them. After the baby is born, it is crucial the baby begins to feed so it can make sure the baby's blood sugar levels are stable. The baby's blood sugar levels will need to be tested as well, and this will start around 2 to 4 hours after the baby's born. If there is any concern this is low, the baby can be fed through a tube, which is a temporary measure. If the baby becomes poorly or healthcare professionals think they need closer monitoring, then specialist healthcare professionals may become involved. If all is well, the mother and baby should be able to go home around 24 hours later. Mothers will be advised to keep checking their blood sugars up to 2 days after giving birth, as they may still be raised. The mother's blood should be checked 6 to 13 weeks after giving birth, as blood sugars can still be raised this long after. However, this is only for a small number of women. Once having gestational diabetes, you are more at risk of getting type 2 diabetes. I'm now going to discuss preeclampsia, which is a complication of pregnancy. Mothers may have high blood pressure and kidney damage. This can affect the mother and the baby because if left untreated, it can lead to serious complications. I'll be looking at how preeclampsia develops, how it's diagnosed, and the ways it can be monitored throughout the pregnancy. There are risk factors which can increase the chance of someone getting preeclampsia. However, even mothers with no risk factors can still develop this. These factors include obesity, age, either being very young or over 40. Family history can be a risk factor if another family member, like a mum or a sister, has also had preeclampsia. Current medical conditions can even increase the risk, like things like high blood pressure, diabetes or kidney disease. Even if it's just a mother's first pregnancy, this can increase the risk. It is unlikely for preeclampsia to happen before the 20th week of pregnancy. During routine midwife or GP appointments, early symptoms should be picked up, including high blood pressure and protein in the urine. If both symptoms are present, then that is an indicator of the condition. However, if this condition progresses, then less common symptoms such as severe headaches, blurry vision, vomiting, rapid weight gain, swelling in the feet, ankles, hands or face, and pain under the ribs can occur. Care plans for women with preeclampsia include regular checks and sometimes medication and supportive care, planning for labour and birth and even recovery. The mother and baby will be monitored by frequently checking the blood pressure to make sure any increases are noticed. Mothers may be asked to give urine samples to check the protein levels, and blood samples can be taken to check the mother and baby's kidney and liver function. Cardiotochographs and ultrasounds are used to look at the baby's heart rate, which can alert healthcare professionals if the baby is under any stress. These can also monitor the baby's growth and the blood flow through the placenta. In some cases, medication is needed to help this condition, as in some severe cases, patients may experience seizures. When this happens, magnesium sulfate can be prescribed to prevent these. Blood pressure medication can also be prescribed to help control blood pressure. Mothers may be advised to try and rest as much as possible and avoid activity. However, this is only advised in severe cases. Patients will be taught on all the warning signs to look out for, like headaches or vision changes, so they know when to contact a healthcare professional. Even emotional support should be involved in a care plan, as carrying a baby can be scary and uncertain time anyway, so with preeclampsia it can be even more scary. Within the care plan, there should be planning of the delivery, as typically mothers with preeclampsia deliver their baby early, which can be by induced labour or caesarean section around the 37th week of pregnancy. Once the baby has been born, postnatal care should include ongoing monitoring of the blood pressure to keep an eye on this. Mothers and family will be informed of any risks the future could bring, as now they are more likely to have hypertension or cardiac diseases. If preeclampsia is not managed or treated, it can cause serious complications for the mother and the baby. Mothers can have seizures, which can be life-threatening. Mothers can have serious complications affecting their liver and blood called HELLP syndrome. Permanent damage to the liver, brain or kidneys can occur, and even strokes. Women can get blood clots and have excess fluid in their lungs, and this can cause death. Babies may have restricted growth, which can result in reduced blood flow through the placenta and low birth weights. In the worst cases, stillbirths can happen and neonatal deaths. Substance misuse during pregnancy, whether this is involving alcohol, tobacco, prescription medication, or illicit drugs, can have serious and profound effects on the baby's development. I'm going to discuss the dangers associated with substance misuse during pregnancy and how this can affect the mother and the baby. Drinking alcohol during pregnancy can lead to a range of serious developmental, physical, and cognitive complications. Alcohol goes directly from the mother's blood to the fetus through the placenta, and the fetus cannot process the alcohol as their liver is not fully developed yet, causing severe problems. Drinking alcohol while pregnant increases the risk of several things for the pregnant person, including miscarriages, stillbirths, high blood pressure, liver problems, and certain medications can be affected by alcohol. Drinking alcohol while pregnant can affect the baby as well. When a baby is exposed to alcohol in the womb, they may get a condition called fetal alcohol syndrome. This can cause restricted growth, abnormal features, and brain damage. Babies' bodies are not developed enough to break down alcohol, meaning the alcohol can stay in their body for a long time. This can cause learning difficulties, bad memory, and behavioural issues. Damage to organs, abnormal limbs, and heart defects can occur as well. There is no safe amount of alcohol when drinking during pregnancy. Even a small amount can cause damage. Heavy drinking or binge drinking is known to have the most severe effects. Using illegal substances while pregnant may cause serious complications to the health of the baby once it is born. These drugs can include cannabis, ecstasy, cocaine, and heroin. As a baby is very vulnerable, the exposure to harmful drugs can have immediate effects after birth, lifelong problems, and even wider issues. Babies who are exposed to drugs like heroin, methadone, or opioids while in the womb may be born dependent on these. Unfortunately, these babies may experience withdrawal symptoms such as tremors, difficulty feeding, seizures, irritability, and crying a lot. Babies may be born with low birth weights, making them smaller and weaker, and they can be born premature, which increases the risk of infection. Lifelong issues can affect babies and children, including problems with memory and difficulty learning. Behavioural issues may arise, such as hyperactivity, and some children may be delayed in meeting milestones, such as walking, talking, and reading. Even the risk of getting chronic health conditions increases, like respiratory issues and weakened immune system. Drugs and illegal substances can have so many effects on a newborn baby, and these problems can move with them into later life. The severity of these problems does depend on how frequently the drugs are used and the type of drug. Thank you for listening.